like that shirt. I kid you not.
It's funny, right?
I think it's very funny.
Funny ironic or funny ha-ha?
Yes. Yes. You're too good of an actor. Stop it. Stop that.
Are you excited?
I mean, I'm excited for what comes after.
Well, I mean, you're wearing a sweatshirt and sweatpants. I feel like you should really doll up for me today. Like
We're in
that,
Spanx.
that should be a reward. Like you should be all dolled up.
I'm not wearing sweatpants. I'm wearing Spanx leggings, actually. And they look like leather leggings, so let's not
Link in the bio.
let's not make it sound like I'm just looking like fluffing up over here.
I was thinking more sundress and heels.
I've been told to not dress sexy or be sexy towards you for the next few days because it can cause you pain, so I'm just being considerate.
Okay.
So saith the comment section. Do you have any last words for Ken's boys? How many years ago did you have yours done?
40 something.
Well, 36 exactly.
36 years.
Because it was right when I was born.
That's when we were born. Yeah.
Who talked you into having it done?
Hey,
No, you said no right
no,
away.
no.
He said, "Yep, okay." 6 kids, 2 grandkids. You're good.
Boy, you good. You're
Right?
good, brother.
Like,
And
he's got a
that-
dynasty. I always hear her go out, on top, and she's a winner. So.
That's right.
Today's the day.
Yes, it is.
You can still tell me I have to do it.
You can still reconsider.
I'm not reconsidering where I stand on the situation, but I'm just saying,
Damn
if
keto
I
carnivore.
had to do it, I would do it. But it is much easier for you to do it.
Easier for you, maybe.
It's easier for you and easier for me. Do you want to take care of me while I recover from anesthesia and surgery?
Yeah.
Yours is topical anesthesia, not general anesthesia.
Well, it should be general.
Okay, says the guy who thinks he can just not take any medications for it, which is fine with me. It's your goo-goo. So we have about a 45-minute drive to Paris, Tennessee, where we're going, and in about 30 minutes he has to take a Valium. And it will probably not affect him at all, to be honest. I don't think you're going to have any woo-wee, I don't think you're going to be affected like I was when I had to take it.
Maybe
Do you?
not. Maybe not. I don't know. I'm twice as big as you, so.
That's what I mean, and I think it's like 1 milligram or
Yeah,
something.
probably take a Valium 10 for me to feel it.
Right. I don't even know. What milligram is that?
Oh, it's a 10.
It is a 10? Oh, well,
Is it?
maybe.
Yeah. Oh, gosh.
Well, then maybe you
No,
might.
I'm not taking all that.
Why?
I'll take a half.
No. Take the whole thing. Don't take it yet.
I'll take a little chip.
Take what's prescribed, Dr. Berry. I don't care, honestly. But I do think that you're supposed to take that much to relax the muscles. So I think you'd be better off for following directions.
Guys, I mean, can I not ride the tractor afterwards? It can't be that big a deal.
I'm telling you, he will probably be out there not only riding the tractor, lifting logs, throwing them, and then he'll come inside and everything will have been grown
I'll need an ice
10
pack.
times. To be very clear, Dr. Berry, is this okay with you that this is happening? Or do you need to blink 3 times for help?
I have made this decision of my own free will and have not been coerced in any way.
And do you want me to have my tubes tied? And
No,
live
I
with
don't.
you?
I
Okay.
don't want
Okay.
that. Yeah.
Somebody.
That's a good start.
You want to hear my favorite comment?
Yeah.
Just hire a nanny instead of making him get a vasectomy. So you're okay with me not taking care of my own children and just bringing more children into the world for the sake of bringing more children into the world, but you're not okay with him having a vasectomy.
We could just get a wet nurse and a nanny and a headmistress, and then you could just knock them out left and
Be a
right.
surrogate and hire a nanny. Do you think Dr. M is gonna let me film myself in there? I'm gonna ask him. I want to ask him a few questions.
think he'll let you
Yeah.
film
I
everything,
need to
including
ask
him.
You think he will?
Yeah.
He's pretty.
Because I want to ask him some questions.
I think if you don't care, he's not going to care.
Yeah, I've got some questions.
You do have questions?
Yeah.
Same. I have questions.
It gets so cloudy talking about reproduction, reproductive rights, and reproductive health.
We could do a whole podcast
We
on
should.
reproductive
We
rights
should do that.
in my Mighty Network.
Oh, you have a Mighty Network.
Yeah,
Oh.
guys. So yeah, I'm making some changes to my Mighty Network, and the people who are in there are going to hear about it first. But let's just say I'm going to do most of my wellness things in Dr. Barry's wellness group. My Mighty Network is going to be like all access live stream, basically what my podcast was. I'm only going to go live in my Mighty Network, with the exception of like doing my makeup on Instagram. And I'm going to talk about things that I would get flagged for on YouTube and Facebook and Instagram. And so, yeah, we'll check back in when the Valium hits. He's just taking his medication.
10 of Valium. We'll see how that goes.
10 milligrams.
Like, I've literally never taken a benzo in my entire adult life. And this was a 10, so.
How much did I have to take for my surgery?
It was like a 2 milligram, wasn't it?
I don't think it was 10. Maybe 5. I don't know. That was a long time ago. It may be loopy doopy. You can actually see me on Valium on Instagram. That story is saved.
Oh, yeah?
Yeah, it's on my IVF highlight.
How long
You
does it take to
videoed
kick
me.
in? 20 minutes?
It was about 20 minutes before I was like, oh. I just started laughing, and we were literally in the waiting room, remember? And I just
What if I
started
show my
laughing.
ass in there?
You're fine with me.
You would love it?
I would think it's hilarious. Yeah. Here we find a wild man. He's been tranquilized.
He's been
and taken
captured
into,
and tranquilized.
captured and taken into this clinic to have his reproductive rights
His
taken away
manhood.
from him. The female sits with a camera. She's what is known in the internet world as an influencer. Oh, I got called an exhibitionist too.
Really?
I'm an exhibitionist. I feel like I am. You am. You am.
I am, yes. I is too.
Do you like your shirt?
Yeah.
Thank you to the person who sent this shirt. It matches your pretty blue eyes. It makes your eyes look really blue.
Don't sweet talk me.
Blue eyes.
Are you having second thoughts? It feels like you are.
No.
No?
Are you?
No. Unless you want to together.
Unless you want to, then we break our vows together. Vasectomy. Doo-doo-doo-doo. I don't want a vasectomy.
He. You seem so happy.
I'm just here to support you.
Mm-hmm. Oh, I may be feeling it now. It may be kicking in. Yeah.
As a medical doctor, do you think vasectomy is a good way of, handling birth control between two consenting adults?
Yeah. I mean, it's probably the least invasive of any method. A lot of people think that birth control pills are without side effects and perfectly innocuous and benign, but that's 100% not true at all. They can have disastrous effects on a woman's hormonal health big time. And not, there's an argument, does it do some degree of permanent
Hormonal damage.
alteration to the hormone status of women? Definitely increases the risk of blood clot, stroke, heart attack,
Right.
cancer. So, yeah.
I mean, there's risks to everything, but in the grand scheme of things, vasectomy is really, really on the bottom. Even with tubules, I have friends that have had tubules done, and they say that they have since then had the worst periods they've ever had in their entire life, where they never had cramps before. Now they have horrible cramps that literally cause them to have to lay down and be out of work some days.
And to be clear, the research uniformly shows that there's no change in your menstrual severity or pain, but at least 70% of women I've talked
hear it all
to
the time.
in over 20 years of medical practice, 7 out of 10 say, oh, my periods are much worse now after my tubal. Yeah.
And a lot of them had the tubals done because they thought it would actually improve
Right.
their periods, and the opposite happened.
Yeah. But the men I've talked to who have had vasectomies, just the regular men are like, nah, it's no big deal at all. It hasn't changed anything. And then the players are like, get a vasectomy right now.
Right.
Yeah.
And I think probably the technique has obviously gotten better.
Yeah.
Maybe like 20, 30 years ago,
Yeah.
vasectomies were done less well.
Oh, yeah.
As opposed to
Dr.
now.
who's going to do mine, his dad, who I used to practice with, it was an inpatient procedure. He literally checked you into the hospital.
Right.
And now it's just it's a simple
literal
outpatient.
No anesthesia, just local anesthesia. Just like if you got your tooth pulled, actually less, because you
Oh,
get
yeah.
gas with
Yeah.
your tooth pulled.
Yeah.
So you don't get anything except you get the Valium.
You don't need anything.
Right.
Yeah.
You don't have to have it. It's not that invasive. It's you can actually YouTube this, I'm sure.
Yeah.
look
And you
it
can
up.
actually
It's
do it
very
without a
tiny.
scalpel.
Yeah, you can
Yeah.
just tear.
Spread the
It
spread.
actually heals better.
So
if
you're
it's done
using
that way.
triggering words for men. Tear.
Okay,
tear what?
sorry.
Tear what? Tear.
Rip. Rip it.
You can just rip open the scrotum. You can separate the tissue.
Gently.
Yes. And you don't even feel it, and it heals much quicker if you do it that way.
Right.
But
Fixing to be 11:15. His appointment is for 12. High noon.
as all good showdowns should be.
Right. How are you feeling now?
I think it's kicking in. I maybe feel it now.
You do?
Maybe. Everything looks a little funny.
No, it doesn't.
Yeah.
What kind of funny?
Like, you know when you got a good buzz
Yeah.
and it's like shit's more interesting than it normally is? It's like, oh, look at
The
that
trees are
maxima.
so green.
Look at that maxima. Wow. Yeah.
All right. It's 11:30.
We'll see when I get out if I can walk or not.
Take off. I thought you were going to try to get out with your seatbelt.
Oh, yeah.
Feel it?
Yeah, baby. Mask up.
You gotta mask up for surgery. How do you feel?
A little bit buzzy.
You are slurring.
Emma,
Yeah,
get the instruments.
I did.
Plain gut. Oh, there's a scalpel. That's bad.
Take your pants off, Sonny.
Did I just drop them?
I reckon.
I should have brought my own pillow. This is not very comfortable.
Well, I don't think they're supposed to be very comfortable. Are they gonna put you in stirrups?
Maybe. You'd love that, wouldn't you?
Yes, I would. I'm leaking milk right now. Oh my god. I forgot my pump.
Hey,
Buenos dias.
Hey.
how's it going?
Good man, how are you?
I'm great.
You're one to have it in you and just completely vibe out. And,
Yeah.
and you know
Either
what?
that or insane in the membrane.
No,
I feel
that's
like
my kind
you
of stuff
pick.
there.
That's two opposite ends of the
Made you
spectrum.
focus.
I mean, I like a little Cypress Hill.
Yeah.
You know?
That's
So,
his favorite
I
song.
mean, I'll do whatever, but
Also, she can record this, right? Not that my, yeah. Okay, because I've got some questions I need to ask you.
yeah, and I know you do your whole,
Yeah.
you could use clips of this and
Yeah.
You know, I think people worry, is this going to cause heart disease or prostate cancer or something down the road?
Right.
You know, studies thus far show that it does not impact that kind of thing. So
Right.
you don't have any long-term deleterious health effects.
Right.
Or performance. That's a lot of the comments I've seen that they're worried it's going to interfere.
It is not supposed to affect performance. The ejaculation is the same. The erections are the same. Your sensation is the same.
Yeah.
Now again, afterwards, I mean, you can speak to that, you know, in
Yeah.
the next couple of months and say firsthand knowledge here.
Shouldn't get on his tractor, right?
What is what?
Tractor.
Tractor? Yeah, I would say no to the tractor.
No to the tractor.
So this is the worst part. This is the numbing medicine. We always say small stick in a burn, but it's a big stick. It's like holding a match down here.
Oh yeah. Okay.
Yeah, it's not fun.
Oy.
Now tell me the baby's name again. I know I loved it.
Bonnie Blue.
Bonnie Blue. Yes, I love that. Now you can tell everybody, you know, the first pain is the burn of the nun, and then that goes away. Secondly, there's a little bit of tugging. So as we're sort of, you kind of feel it up in your groin on
Yeah.
the side.
Kind of like when you get thumped in the nuts.
Exactly
Kind of feel
right.
it in your belly.
Exactly right.
Yeah.
So here's a little more numbing medicine. Usually this is not as painful as the first injection.
Do you feel that?
Barely.
Barely.
Good.
Do you want to see? Do you want me to record so you can see it later? Okay. You did so good.
That was easy.
Like a champ.
I was shocked.
I love him. He's so funny.
Yeah, he's great.
When we get in the car, you going to show him your souvenir?
Yeah.
Okay. Dr. Mobley gave him a souvenir. You going to show him? While it's still fresh.
Dr. Mobley's a urologist, and he's been doing this for years, and he said
Long time.
that I by far had the largest vas deferens he's ever seen on a man. So
I wasn't going to say anything, but then I was like, I just feel like those are bigger than they should be. And I told him, I said, I was thinking these would be smaller, but it's been a while since I've seen this done. He's like, no, these are big.
Huge is the word he used.
Okay.
Yeah.
So anyways, overachiever over here. That's why he's so fertile. His vas deferens are huge. But now they are snipped, burnt, clipped, and tied.
Yeah.
He did a 4-stage. 4-stage. We're done here. He did a good job. How do you feel?
I feel okay. The worst part of it was just the numbing medicine, the little tiny shot.
It's gonna numb. The numbing's gonna wear off. Do you want a pain pill now?
I'm good right now. I might take it later.
What do you want to eat?
I don't care. I really want some lamb, but am I acting stupid?
No, you're not acting stupid. I was literally looking for my phone. Which is right there. You're not acting stupid.
Okay.
If you want lamb, we'll go get lamb.
We can just get
Dealer's
burgers.
choice.
We'll get
Burgers are okay?
Yeah, that's fine.
You sure?
Yeah.
Okay. All right.
So I can get home and get on my tractor.
Not funny. So, what's the verdict? Stop it.
The procedure itself was no big deal at all.
And a few hours later, how do you feel?
I've got maybe 1 out of 10 right nut pain and 0 out of 10 left nut pain. I'm trying to take it easy because my wife is making me lay on the couch.
Yeah, if it was up to you, you'd be like, I'm gonna go outside, I feel fine.
I can cut down a few trees.
Right. And you can. But then you can't do anything for a week once you've done that. So overall, anyone thinking about getting this procedure done?
Yeah, there are way worse things. When I'm up at 3 a.m. walking with Bonnie, that's worse than this.
Exactly. Exactly. All right, tell everybody goodbye.
Get it done, gents. It's okay. You won't die.